stream the meeting. This meeting is being live streamed.
Good morning, Tonya.
Good morning, Najat.
I know I said this yesterday, but I'm really excited to have this conversation with you. For anybody who is tuning in live, I am Najat Washington. I am the assistant over here at Tonic PT, and we have the one and only Tonya Juge, who is the founder and creator of Tonic Physical Therapy. And I'm really excited to sort of like talk about why Tonic, why this path, and just get a little bit more insight and have everybody get a clearer idea of what you do, how you do it, and why you do it. So let's talk about, so Tonic, so physical therapy is actually your second career. So let's talk about a little bit about your experience as a trainer. You were a trainer before you were a physical therapist, and that was actually news to me. So I'd love to hear about that experience for you.
Okay. Thank you, Najat. As she said earlier, she's my wonderful assistant that takes care of all of the patients. Sorry, we're on a little bit of a delay here. So let's see. It was a second career for me. It was sort of a long road to PT, even though it had been a lifelong interest. I actually have 2 business degrees, and then I went back to school for physical therapy because I was the only business person who knew all the muscles in the body just for fun. And I had always had a lifelong, interest in exercise and just sort of figuring out the body, as well as some issues of my own with, wearing a back brace for a couple of years and being told by doctors, that I might, have paralysis in my feet and I needed extensive surgeries, that sort of thing. So I went back to PT school after I graduated in business and after I moved away and started working, and just realized it was something I had to do with my life. So did that answer your question, Najat?
So how long were you a trainer before you decided to go back to PT school?
Well, I decided to go back to PT school when I started training, and I trained for 10 years. So it took me several years, like 7 years maybe, just to get all the prerequisites I needed for physical therapy school that were not a part of my business degree, all the biologies and, with the labs, that sort of thing, that were necessary. And then I had to apply to physical therapy school, which was really challenging. They only accepted about 36 people a year into the program. And there were about 600 applicants every year.
Wow.
So that was it was actually harder to get into PT school than medical school at the time.
Wow. And so after you graduated PT school, you didn't start Tonic right away. So why did you decide to start Tonic specifically?
Well, I had the fortune to work for really, really good clinics that spent a lot of one-on-one time with their patients. And that was a really great way to start a career rather than being in one of the cookie cutter type clinics that were, where therapists were seeing 4 or 5 people an hour. So that allowed me to develop a lot of my skills and take a lot of continuing education courses and actually figure out how to apply those courses. And I don't know, I just felt like I'd always felt like I could have my own business, and I always had a pretty good patient demand and a waiting list. And at the time I was working for a really awesome clinic, yay H&D.
I didn't know if you were going to mention them.
They were wonderful and are wonderful. And so I just wanted to do something on my own, and I felt like I could do it and have a little more freedom in my day-to-day life in order to, orient the business towards the, in a way that matched me and allowed me to provide better care of service while I was also possibly taking care of myself a little better. So
yeah, I mean, if you don't take care of yourself, how can you take care of others, right?
Yeah.
So what is your approach to your clients? Like for your clients, what is the approach that you take? Because I know I have spoken, because I do your scheduling, I've spoken with a lot of, current clients, former clients who are now current clients, and they always tell me, oh my God, Tonya is amazing. She approaches things so different from other physical therapists. So from your perspective, and because you're the one that's hands-on with the clients, what is your approach exactly when it comes to your clients and your patients?
Yeah. I have a lot of patients tell me that as well. And it always sort of confuses me. I'm like, but this is physical therapy. This is the way physical therapy should be done. And I mean, I guess having a solid hour with the patients and having an advanced certification where I really delve into the source of the problem and I coordinate the exercises with the deep tissue and the mobilizations that I do. I also think that, since this was a second career for me, throughout my education, I was a little older than the other people in my class and had experience for 10 years as a trainer. And I had so many people come to me when I was a trainer and say that they had had this really insignificant experience with physical therapy. And I just thought that's so sad because I knew how hard it was to get into PT school. I knew the level of knowledge that physical therapists have and the level of training that they had. And I just thought, if anyone ever comes to me as a physical therapist, they're going to leave knowing that we've made a change, knowing that this has been significant. And I want them to have the experience of being truly helped. So I think what informs my whole approach without even realizing it is this, I don't know, while I was learning everything I was learning in PT school, I was approaching it from that point of view. Like, I want to make sure this can be significantly applied to my patients. How can I make this tangible and beneficial from a patient's point of view? So I think that informed my approach more than anything when I consider it. Everything has to be tangible and functional and make a difference in people's lives. And I don't know, apparently it seems that it does.
I'm definitely, I mean, at least from what I hear from patients, it definitely does. Now, I know you had mentioned yesterday that you recently were at a conference, which was what kind of sparked this whole conversation, because of, how other people approach their physical therapy businesses. And you kind of approach your business a little bit differently, the business as a whole. So what are like your goals versus some of the other, people that you've met?
Yeah, and this is nothing against the other PTs because most people get into PT because they really have a genuine interest and they genuinely want to help their patients. But I found that the whole focus was on how big your clinic was, and you were sort of ranked based upon, how many clinics you had and level of, grouping and importance. And there was just this underlying even shame amongst the smaller practitioners, like they weren't there yet, and my statement was, I don't want to be there. I want to have the most personalized, individualized service for my patients. Like, I never want to have 10 clinics or 3 clinics. I just want to deliver the best one-on-one care that's possible for each and every one of my clients. And that to me is my idea of growth and my idea of success. And I just didn't realize, until I was amongst a whole bunch of people. I mean, I'm sure they want to benefit their clients as well. But I just want my focus to be on the patient and not on managing the business and not on, all the other aspects of running the business, although, sometimes it has to be. And that's what I want to talk about. That's what I want to spend my time on. And I feel like that somehow sort of transfers over into the care and into what's communicated to the patients.
Now, can you tell anybody who's watching now or who's going to be watching the replay where exactly you provide services, like in what area, and how your goals for your business affect appointments, availability, scheduling, and all of that stuff?
Sure. I'm on the Upper East Side for concierge PT. I go to people's homes. I've worked in that area for 20 some years. And so I've, worked with the doctors in that area. So people know me, patients know me. Because of the logistics of this business, spending an entire hour with each patient, there is a limited number of people we can get on the schedule and a limited number of offerings. Like you might call another PT clinic and they'll give you 5 options for times. And so we may only have one option or 2 options. It may take a few weeks before we can actually get you on the schedule. And because if I could clone myself, I would, but there's only so much
Only
time
one Tanya.
in the day. I don't know if that would be good or bad, but convenient though. And so, so that's kind of the benefit. And then the challenge of it is because there's only so many hours I can schedule in the day. Most PTs see 20 and 30 patients a day.
Oh, wow.
Aides are working with them, and then they're being scheduled and they pop in for 10 minutes. And then the aide or the assistant works with the PT, the patient, the rest of the time. I am there one-on-one for a solid hour. You'll never see me walking into the appointment looking at the chart to figure out what your name is. Actually, it takes about 5 or 6 hours that go into the first appointment, believe it or not, between onboarding the client, giving them all the information they need. And once the patient fills out all their paperwork, I really sit with that paperwork for a good hour and I go through it and I develop a plan so that when I walk in the door to see you, I already know what's going on. Of course, we'll evaluate and see if what I, think from what you've written matches, what I think is the plan. And I have to evaluate again, so that's where I am most of the time, Upper East Side, concierge PT in people's home and office. And I have a brick and mortar location on 28th and 5th, which is like in that Flatiron area, Madison Square Park, and I'm there 1 to 2 days a week. And that's for people who don't live on the Upper East Side, patients who live in Brooklyn or the West Side or something, and then they come to see me there. And so, yeah, and it kind of varies how much I'm there versus how much I'm on the Upper East, depending upon, the time of the year and the scheduling.
Awesome. Well, this has been great. Is there anything else that you'd like to add that you think people might want to know about you or your practice, or, a fun fact, maybe?
A fun fact. I like to travel. And I kind of am in art. If you watch my feeds, you'll find a lot of art pieces and things from visits to museums on there. So, and I've always actually considered physical therapy my art. I do a little on the side as well, but PT has always felt like an art to me. And I've actually had patients who are artists tell me that I'm an artist, or it feels like when I'm working with them, it feels like I'm an artist. And I take that as with the highest compliment possible.
That is a really high compliment. I mean, I know you also look at the body as like a structure, like you would a building, the foundation and the layers of.
It's very informed with thorough anatomy.
Yeah.
And teaching of the patients. I can't always bring my skeleton along with me in the street, but I usually bring.
That would be fun. That would be a sight on the Upper East Side.
I usually bring like some laminated things that have, illustrations of the body so that I can really explain to people, because I really believe that if you understand your body, I mean, this machine, we are with it every day, 24 hours a day we live. This is our true home. So I really believe that when people understand their body and know more about it, then they can become their own healers. I mean, the body does heal itself to an extent, but with a little help and a little knowledge of that wonderful, miraculous system, you might be surprised at how you can heal and how you can change and feel better than you do right now.
Well, thank you again, Tonya. I know I've learned a lot working with you about, your perspective, your mindset, your approach to physical therapy, and about the body. So if this was interesting, I do want to let everybody know that you are going to be doing Tonic Tips live again, like we had done. I think it was was it last summer? We
It was
did
in the
Tonic
fall.
Tips, or in the fall. So Wednesday starting June 22nd, I believe. So every Wednesday from June 22nd to July 13th, we will be doing Tonic Tips. So look out for those. And
Well,
yeah.
I'll pick a topic. It might be sleeping posture, and I'll give you some hints and some tips on that. But by all means, if there's something you want to hear information on, please send us some comments, and I'll be sure to include, your topics in Tonic Tips.
Yes, please comment below, send a message, send an email, check out the website, tonicpt.com, and you can even schedule a consultation with Tonya. So thanks again, Tonya, and this was fun.
Yeah, thank you, Najat. And Najat, again, is my wonderful assistant who's very organized and will take care of you, do all your scheduling, answer your questions. So treat her well.
Well, have a great day, everyone.
Okay, thank you.